There are many statin drugs available. It is true that about 15% of patients who take statin drugs complain some muscle pain, and sometimes it's significant enough that they prefer not to take the statin drug. When that happens, it's always a good idea to try a different statin drug than the one that somebody is taking. In fact, I try almost all statin drugs before I give up because they are so important. So it's not a class-specific effect that if one drug causes muscle pain, the other statin drug will also do that. It's extremely important to keep trying until one of those statin drugs works for you. Another strategy sometimes that can be useful in people who have significant uncomfortable symptoms such as muscle pain with statin therapy is to initially they can try statin drug at the lowest dose and even take it every other day or sometimes even twice a week, and then gradually increase the dose. And finally, make sure that you have your vitamin D level checked, because some people with low vitamin D may have muscle pain that goes away. Or sometimes there may be other causes of muscle pain such as underactive thyroid or any other secondary cause. So all of these other causes should be ruled out before blaming it on statin therapy. So one of the questions people worry about, phenomena that was described many years ago with the older drugs, is that cholesterol pill might affect my liver function. It is an extremely rare event. Even at a high dose statin therapy, the chance of significant liver injury is less than 5%. So when we start statin therapy, we always check liver enzymes before and several weeks after starting statin therapy. And after that, it's not necessary even to monitor liver function because it's so uncommon unless there are some symptoms that patient may develop. My general philosophy is that I check liver enzyme in the beginning after starting statin therapy after several weeks, and then if I increase the dose of statin, then I check it once again several weeks later. But again, one should keep in mind that the benefit of statin therapy far outweigh any potential side effects. Therefore, one should make every attempt to stay on the statin therapy unless there's a real contraindication or the rare patient who develops either liver problem or some other undesirable side effect. For years, we have had the luxury of having a number of cholesterol-lowering drugs. We have at least 3 other classes of drugs that are available for lowering cholesterol besides the statins. However, no other drug has been proven to prevent heart attacks as well as the statin drugs have. Simply lowering cholesterol by a drug may not mean the same thing as lowering the risk of heart disease by a proven therapy such as statin. In those rare cases where statins cannot be used or statin dose cannot be increased to a sufficient amount, then we do use other drugs when statin therapy is not by itself equally effective or very effective. So yes, there are other drugs, but they should only be used when the statin therapy is impossible to use in the right dosing.